Hi, this is Dr. Stewart. I was going to demonstrate what we do for a dental procedure. I brought in my own dog, Clark, who is currently under anesthesia. And I was going to go through a little bit about what we do for what's involved with the dentistry. So, being that it's National Dental Health Month, so we can take a look at Clark's teeth here. So this is Clark's mouth. I'm going to kind of show the amount of tartar he has on his teeth. He just had them cleaned a couple of years ago, but it doesn't take long to get a lot of tartar forming on your teeth again. And he's got some gingivitis along his gum line here, so we're going to scale and polish his teeth. I'll show you exactly how we do that. So, Krista, if you want to start. She's using an instrument called a rongeurs to remove some of the big chunks of tartar. And tartar is like cement. So once it's on the tooth, the only way to get it off is by using dental instruments. Brushing does not do it. So, I've had some people ask me if they can just brush their dog's teeth, if that's appropriate. And I always endorse brushing teeth. However, once you have tartar on your teeth, brushing will only help to prevent further tartar from forming, but it will not get rid of the current amount of tartar on the tooth. So first she's going to be working on just getting these large chunks of tartar off, and next we're going to use our ultrasonic scaler. So Krista now is probing the teeth, and this is looking for pockets. When we find pockets that are more than a couple of millimeters, that may mean that the root may have some disease associated with it, and that tartar has actually gone all the way down to the root. So this is what a lot of dentists will do in human medicine as well, but we're looking for pockets to make sure that we're not missing anything. So now Krista is polishing the teeth, and she's using a special compound toothpaste that and a high-speed hand instrument that is going to polish off all these tiny little abrasions that we made in the enamel of the tooth. By doing this, it'll help prevent tartar from forming easier in the future. If we were to scrape all the tartar off the teeth and leave all those abrasions, tartar would form much easier and make dental cleaning much more frequent. So that's the idea behind polishing. There's a technique to polishing that you can't overdo it, or you can actually polish through the enamel. So they have to go through training in order to do this the best way. So what we're doing now is just finishing up polishing his teeth. The final step that I do during my dental procedures is that we'll apply fluoride. This is the same kind of fluoride that people will get in their dental office. And this will help to strengthen the enamel. Basically, we try to do everything we possibly can so that they don't need much more frequent dental cleanings. But a lot of dental disease is genetic, hereditary. So, if we're unable to brush very often, then it just depends on hereditary components. So, in Clark's case, he's got pretty bad dental genes. All of his siblings have bad teeth. So he needs pretty frequent cleaning. So we'll let this fluoride sit for about a minute, and then we'll wash it away. This is one of the many reasons why they need to be anesthetized and have this tube in place, because it protects his airway. Because if they were potentially awake or they didn't have a tube in place, there would be a huge risk of them aspirating or inhaling all of this stuff and then getting pneumonia and other awful things, awful consequences. So for good or for bad, anesthetized dentals are still the gold standard in cleaning teeth in dogs. It's the only way to get tartar off underneath the gum line, no matter how good your dog or cat is. And so once this sits here, we'll rinse it away, and then we'll turn off the anesthesia and wake him up, and he'll have clean teeth and fresh breath. So every dog, needs to will need to have their teeth cleaned. Some dogs can go a year, 2 years, or longer. Some dogs need it every 6 months. So again, a lot of it is based on their genes. So, but we always we'll talk to you about that during all of your every time you bring your pet here, and we'll make appropriate recommendations.